transformative ideas that you've put out for us, almost like a challenge for us today. So next we have on our panel, I'm very pleased to introduce Abdulasis Hashi, the Community Health Worker Program Manager with Banadir Primary Healthcare Consortium in Somalia. Hashi brings over 12 years of experience in public health, currently leading the strengthening of community health worker activities, including social behavioral change across the consortium's operational sites. So thank you very much for joining. We're glad that you were able to get online, and we really do look forward to hearing about your experience from participating in the Global Nutrition Cluster Project to strengthening capacities of national organizations in Somalia. Over to you. Thank you.
Thank you. Thank you very much. I hope everyone is able to hear me.
We can hear you.
Thank you. Thank you very much. Hello, everyone. Good afternoon, ladies and gentlemen. I pass my warm greetings to the wonderful people gathering in here, the presenters, panelists, guests, and everyone joining to this important event of Rome Nutrition Week. It's my pleasure to join this panel session of Rome Nutrition, and many thanks to the GNC for the invitation, and also my appreciation goes to the other partners who are also hosting this important event, starting from Government of Canada with the collaboration of GNC, ACF, WFB, Nutrition International, and also SCF. Thank you all. So my name is Abdulasis Hashi. I'm a public health specialist and currently working with a local NGO based in Somalia, BBHCC, Benadir Consortium. I'm a CHW program manager. So BBHC is a local NGO based in Somalia that has been founded in 2011 with the aim of responding relief interventions to the humanitarian crisis that was hitting that time in Somalia. There was a severe drought and famine that were hitting many parts of Somalia. So the main aim was to respond those humanitarian crises with the partners and international partners working in Somalia, including GNC, providing support of nutrition information and all these informations. So GNC has been supporting capacity strengthening in Somalia since a long time ago. So BBHC was one of the partners that were receiving those capacity strengthening activities provided by the GNC. If I name it, there were about 6 capacity strengthening projects that have been implemented through GNC, namely social behavior change, gender and nutrition, GBV, logistics and supply chain management, security management, human resource management, training sessions, and also proposal and report writing training sessions. So according to our experience, we are here to share some experience that we are implemented, and we have noted an impact on the way that we are operating now currently. So if I start with the GBV, we have noted that GBV not only impacted the physical and psychological well-being of those directly experiencing the violence, it also harms others, including survivors, children, and can have wider-ranging harmful effects on those social fabric of communities. So we have established 2 initiatives through the GNC support of capacity strengthening. One is the community care model. The community care model is a structured community dialogue with capacity strengthening for GBV response services in order to promote both change in social norms that can contribute to gender equality and reduce gender-based violence. So with many settings implemented, community care model found a reduction in the belief that women and girls should avoid reporting rape in order to protect the family honor, and reduction in the belief it is appropriate for a husband to discipline his wife using violence. So it engages community elders and local authorities to feel the magnitude and burden of GBV and take GBV cases to justice platforms. So in an emergency situation and in war-torn a nation like Somalia, there were increasing incidents of rape, and the most worst situation was that those who commit the rape issues that were escaping from the justice, and they were trying to cover these rape activities with the so-called killing honor or family honor, and also trying to do a forced marriage of the victim to cover their crime. So the community care is a model that can provide a safe haven for the victims of GBV, and also engage in the local community, including the religious elders and religious authorities, community elders, that justice should be taken to account to those people or those who commit the crime of rape. The another model is safe spaces. Safe spaces is specifically targeting the victims, which is providing counseling sessions to the victims who experiencing PTSD, and also provide clinical management of rape, CMR, and also providing a safe environment that they can feel safe and secure. So those spaces serve multiple functions, including but not limited to acting as an stigmatizing entry point for survivors to connect with specialized GBV response services. It also acts as a programming model to improve the safety and resilience of women and girls who undergo rape and GBV incidents. So this platform aims to facilitate access information and services in a way that is safe, culturally appropriate, and accessible to particularly marginalized women and girls, such as engage in the local community, including the religious elders and religious authorities, community elders, that justice should be taken to account to those people or those who commit the crime of rape. The another model is safe spaces. Safe spaces is specifically targeting the victims, which is providing counseling sessions to the victims who experiencing PTSD, and also provide clinical management of rape, CMR, and also providing a safe environment that they can feel safe and secure. So those spaces serve multiple functions, including but not limited to acting as an stigmatizing entry point for survivors to connect with specialized GBV response services. It also acts as a programming model to improve the safety and resilience of women and girls who undergo rape and GBV incidents. So this platform aims to facilitate access information and services in a way that is safe, culturally appropriate, and accessible to particularly marginalized women and girls, such as those with disabilities and married adolescent girls. So that was the kind of model that we have provided to the communities that we are providing support through the capacity strengthening project provided by GNC. We have implemented two notable interventions, which are establishing GBV specialized programming to two humanitarian contexts managed by BBHC currently, namely in the Mogadishu, which is the capital city, and also by Doha in the south central Somalia. We also did adapting and expanding communities care model to two new emergency affected contexts in Baidoa and also Kismayo, which is the southern city of Somalia. So we have implemented those interventions, and we have a team that are working currently, and also they are reporting to the line managers of BBHC here in Mogadishu. The second model that we have received a notable impact on the capacity strengthening project is the SBC social behavior change. We have implemented formative research decision tree, which is helping the communities and the local communities to assess and identify key segments of participants or beneficiaries. And also it lets the teams that are working in the SBC to understand the priority behaviors that are practiced by key segments of participant groups, and also why those segments practice current behaviors, how key segments of participants could practice improved behaviors in their context. So it was a kind of model that was trying to understand what are the local needs or what are the current needs of the community, and how these social behavior change sessions and messages are delivered to the beneficiaries of those affected people in the drought areas, and how likely are they benefiting from these SBC activities that we are implementing, and also providing and also assessing the key segment groups of those participants. Strengthen skills, we have notably did a user-centered approach, which is used to design and test feasibility of solutions, such as human-centered design and trials of improved practices. So we have trained our teams in those centers, and they are now implementing. So BBHC has exercised this approach to assess the gender-sensitive nutrition factors among beneficiaries of the nutrition program. The implemented interventions, according to SBC, we have enhanced SBC activities in health and nutrition facilities to ensure service providers use counseling techniques that reinforce positive behaviors. We have also trained the care providers in IBC, interpersonal communication skills, which is also taking a great role in understanding by the beneficiaries of the kind of messages that have been provided to them. Also, we have trained them counseling techniques to encourage open dialogue with also beneficiaries and patients, those who are undergoing nutrition programs. So these are the kind of steps that we have implemented in the GBIF and the SBC. And I can conclude my presentation at here. Thank you all, and over to you.
Thank you so much. Thanks. It's great to go from sort of what was presented in the first panelist to the second one to really look at on the ground and what your experiences that you've shared with us from Somalia, and just how capacity building can really strengthen some of the activities that you're doing on gender-based violence and social behavioral change activities. So thank you very much for that.